Welcome back. Medical marijuana is now available in Florida, but you won't be able to get it right now in Sarasota. This week, city commissioners voted to ban marijuana dispensaries in Sarasota, but directed staff to come up with an ordinance that will eventually allow them. The problem is commissioners wanted restrictions backed by the police and city attorney banning dispensaries from operating in residential neighborhoods and prohibiting drive-through windows, but the new state law signed by Governor Rick Scott forbids communities from enacting rules more restrictive than those outlined by the legislature. And joining us for more on medical marijuana is Dr. Barry Gordon, chief physician at the Compassionate Cannabis Clinic in Venice, and Liz Albert, vice mayor of the city of Sarasota. And Liz, let me start with you.
Okay.
Didn't city commissioners know that that you cannot have an ordinance that would have been more restrictive than what the state law called for?
No, because they didn't pass that until the special session. So that was just done in the beginning of June. So what we were planning was a restriction where there would be maybe in office areas and other commercial areas that we thought would be appropriate for this sort of thing. But so this was kind of a monkey wrench for us to find out that we weren't going to be able to control that.
What is the biggest concern about having dispensaries, whether it's close to neighborhoods? I mean, after all, we have Walgreens and CVS in residential neighborhoods. And what kind of problems do you think that could result in? Well,
here's what, the concerns that I have, and that, the police department and others who are more expert in this than I am have conveyed to me. If you can only regulate them as you do pharmacies in the city, you can have them in any zone where a pharmacy can go. So we're going to start out with 17 licensees in the state of Florida that can have 25 dispensaries. So let's say at St. Armand's Circle, we have 10 of them that want to open in competition with each other. They could potentially not only take over a whole district, but you also have the safety concerns in that it's an all-cash, very lucrative business. So you have the potential of robbery of the place itself. You have the potential of robbery of the patients. So it's going to require more law enforcement.
Dr. Gordon, I mean, that is a legitimate point, because after all, CVS and Walgreens deals with credit cards and so forth. If you're dealing with a cash-only business, that does make you ripe for some kind of abuses that other pharmacies wouldn't have.
It's one of the complicating things that we see, Alan, because of the Schedule I designation, of course, at the federal level, the banking restrictions and making it a cash business and things of that nature. But believe me, I can well reassure you that the security within the dispensaries is at the highest level.
Well,
and that's required actually within the legislation itself.
What is the history here? How has this worked in other states? And Liz, the concerns that the police department and the city attorney and yourself have may be legitimate, but is it hypothetical, or is there really kind of a history in other places where this has become problematic?
Well, without knowing what the laws are in other areas, we don't know for sure, and that's one of the things that the staff is going to bring back to us. But we do know that in places such as Colorado, where it is recreational and not just medical, there, for instance, was an area called Antique Row. That is not Antique Row anymore. Now it's Green Row. Every place has been taken over by marijuana shops. Would that happen with medical marijuana? We don't know if that would or not, but you do have pharmacies who, a Walgreens opens on one corner, CVS opens on the other corner. There is going to be a lot of competition, and I think a lot of, desire to open several in one area.
We have less than a minute left, but I want to give you a chance to respond to that.
Well, I think, Alan, what this points out to me is that it's been a big difficulty for the legislature to separate out recreational from medicinal cannabis. And I think we need to continue to focus on that. I brought some products in today to show.
And I want to talk about that, but isn't that kind of a slippery slope? I mean, Colorado began with medical marijuana and went to recreational.
I think what every state and every community has shown, that once things die down to a certain extent, it becomes just like any other pharmacy, Alan. And I think that's what the research shows.
We will take just a quick break. We are just getting started, and we'll pick up our discussion right after we check on the weather, so stay with us. Welcome back. If you're just joining us, we are discussing the legalization of medical marijuana in Florida and the restrictions still in place against patients and dispensaries. Our guests tonight are Dr. Barry Gordon of the Compassionate Cannabis Clinic in Venice and Sarasota Vice Mayor Liz Albert. And before we move on this subject, Liz, I wanted to ask you, what is the range of opinions on the City Commission, and is it influenced by the fact that the police department seems to be more conservative in terms of welcoming in this new law?
Well, I want to clarify that I don't get a chance to talk to my commissioners, fellow commissioners, except at the commission meetings.
And it caused a little trouble, I've heard.
Yes, yes. So, but my sense was Monday night at our commission meeting when we discussed this, that I felt like everybody on the commission was actually for trying to make it work, to have dispensaries in the city. But I do want to make it clear, though, that it doesn't mean people can't have medical marijuana in the city. They can have it delivered, or they can go to the Bradenton dispensary once it's opened in August. So, they will have access to it. It's just, will there be dispensaries in the city? And I think our concern was just how much proliferation there could be. As I said, the number, and that they could be in residential neighborhoods, they could be anywhere. And I know we've got citizens who are concerned about, businesses going, the types of businesses going in their area.
Doctor, isn't that a legitimate concern? Because, yes, we have free enterprise, and if something catches on, that's how our economy works, and you don't have these, you don't have rows and rows of pharmacies like Walgreens and CVS in one area. So it's not a cultural thing like it has become in places in Colorado like Denver.
I don't think there's going to be rows and rows of medicinal cannabis dispensaries, Alan. Each dispensary organization is only allowed 20 about the entire state.
No,
now there's some phase-ins, or 25, I'm sorry, sure. And there's phase-ins for more patients getting into the registry as time goes by.
Yeah, and then that's going to grow. So, and they're going to open in the areas where they can,
sure.
and in the more urban areas, more likely, where they can sell a lot. I mean, it is a very, very lucrative business. So a lot of people are going to, if they can get into it.
But so are liquor stores.
Yeah, but we can regulate how many liquor stores and where they go.
Well, and I think the regulation of the dispensaries is not unreasonable. I just think an outright ban is difficult for patients. You have to remember that delivery charges occur when dispensary delivers. Patients would have to drive to Bradenton. So
they would either have to, which would be like driving maybe from Longboat Key to Sarasota Memorial to get a test. I mean, it would only be about, I think, 14 miles. Not, and you can get as much as a 90-day supply, is what I understand.
That's true. But you have to remember that the level of debilitation of a lot of the patients is such that 14-mile drive may be a considerable effort for them.
I would ask a question, but you both are doing a good job of making very good points. But, Doctor, let me ask you about this. And you brought some show and tell today. And the differences, I understand that, is some of the product that you have there has THC, which is the active ingredient that makes people high. Some doesn't. And as we just saw earlier in the show, John Morgan is suing the state, saying that in writing the ballot initiative, people were supposed to be allowed to smoke marijuana and not just vape it or apply it in oils. What's the difference?
Well, there's a big difference. Smoking, of course, is combustion of the leaf of the cannabis plant itself. When you talk about the vaping, you talk about products that come in a cartridge such as this, where you put it onto a battery and the vape comes out of the end, and it's a water-based process, right? And it's supposed to be much more effective for the, as far as protecting the lungs. But the key, Ellen, is that this type of delivery method gives the patient control over the delivery in a much better fashion than other methods do.
So two questions, or a number of questions. Number one, is smoking it a more efficacious way of ingesting it?
Smoking it allows you to use the entire cannabis product itself in what's called the entourage fashion. In other words, you want not just the THC, but the CBDs and the other 140 components of the plant.
But obviously it's not good for your lungs.
Well, there's a lot of things that aren't good for your lungs. Smoking cigarettes, of course, aren't good for your lungs, and alcohol causes significant brain, heart, and liver damage. So I think, once again, you're talking about an individual choice and doctor-patient discussion to make sure that you limit the risks for patients. But, you know, let's face it, if you're a terminal cancer patient and the smoking delivery method is how you can really get your best relief from nausea, from the severe cachexia or the wasting syndrome that occurs, that patient should be allowed to use the medicine as they choose.
And of course, that in our earlier story, the Republican leader in the Senate said that when you smoke it, you cannot control the dosage as you can in these other.
I'm so glad you brought that up, Alan. You know, doctors are funny, and I've been one for 35 years. Doctors want control. They want to say 10 milligrams 3 times a day for 10 days. You do this or you're not a good patient. With cannabis, it's the opposite. Doctors can give patients control because there's literally no overdosing of cannabis, so the risk profile is very low. So each patient gets a chance to find their individual mark, that sweet spot, so to speak, with the combination of the CBD and the THC product. And the dispensaries are key in that. They act like a pharmacist.
Liz, are you concerned that if John Morgan's lawsuit is successful and you're bringing this other element in, that it's really kind of changing what you're all thinking about in terms of trying to regulate it here in Sarasota?
I don't think it changes, you know, whether, you know, the idea behind the dispensaries. You know, as I said, we really had planned to pass an ordinance to get dispensaries, and the only reason we can't do an ordinance now is we just didn't have time to do something, and we had decided that July 17th our moratorium was going to go away because we wanted to get dispensaries in Sarasota as soon as possible. But with the smoking, my question, I actually asked the you know, police department, why can't people smoke it? Because I just assumed when I voted for it that people would be able to smoke. And they talked about the issue of, as you said, it's harmful to your lungs, so how can you tell people to do that? But also the smoking in public. You know, what about the secondhand smoke that somebody else is breathing in the marijuana air? I mean, I'm not an expert on that, but that's what, you know, some of the things that they said, and you can't, you know, even if you have a no smoking area, can you stop people from smoking marijuana because that's their medicine?
Doctor, that's a legitimate question because I know, speaking for myself personally, I do not like smelling cigarette smoke out in public. It bothers a lot of people. There are concerns about secondhand smoke. Now you put on top of it, it's not just tobacco that you're smelling, it could be marijuana. That's something that, you know, for years that we have not really, it has not been acceptable.
Well, smoking of anything in public isn't allowed, Alan. You can't smoke cigarettes, of course, in a restaurant and a bar. And smoking of cannabis was never going to be allowed in any bill coming out of the legislative level. And that's quite frankly not what the whole discussion is about. It's private use within the home. I don't think anybody has ever been asking to smoke cannabis out in a public place.
Does that answer your question?
I think, you know, I mean, theoretically, that sounds good, but if somebody really needs their medicine at that point, how do you in a public place say you can't smoke it? You know, I'm not saying whether I'm for or against it, but those are the reasons that I was given as to why smoking could be problematic, and that's why the legislature said we
have less than a minute left, but I want to, I mean, we're not the first state to be grappling with this issue. Have other states, you know, legalize this without putting people who have concerns?
You know, Alan, when I was in one of the other times with you, I said, why are we trying to reinvent the wheel here in Florida? There are other states, of course, that have implemented this very appropriately. And I think, you know, looking at those states for guidelines is very, very appropriate. And, you know, Vice Mayor Alpert, I say to you that you're, as the council is, they're negotiating through the fog of implementation right now, which is quite frankly what I've been doing for 6 months. I respect the council's decision and processing going through, and I can see that I think ultimately we will come through for the patients here in Sarasota.
Let's take a quick break, and when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about last night's topic, the rising boom of Suncoast real estate, real estate market. Welcome back. Where should we go with medical marijuana dispensaries being allowed to set up shop? Should patients be allowed to smoke medical cannabis? And what kind of changes can we expect to see when the law goes into effect further in October? Our guests join us right now for final thoughts. Liz, were any of your questions answered tonight?
Probably Probably not. I mean, maybe a little bit in terms of looking at, you know, how the doctor sees what's going to happen, but I still don't think it affects the underlying issue that the commission has, because we also have, you know, we have to balance people in our neighborhoods who complain about traffic. One of the biggest issues that we deal with in the city is the increased traffic. I mean, we had one area where, you know, traffic was going to increase just 1 car an hour, and the neighbors, you know, didn't want a facility opening. So, you know, we're going to have to balance both people, the people who want the dispensaries and the people who don't want increased traffic in their neighborhoods.
Doctor, I mean, there is concern about whether these places will become almost, you know, in small versions, a mecca for people coming into the area where they may not be wanted. You know, how do you respond to this?
Well, you know, I respond by saying, Alan, I would invite anybody to come down to my clinic, see the type of patients that are coming in to see me, average age 54. And these are medical patients. And I think the outlook will change as time goes by, and council and other legislative type of folks see that these are just average Floridians, quite frankly, that are looking for another alternative to their pain, their anxiety, their depression, and the other medical problems that they have.
I don't think the issue is who's getting it. I don't think you know, I think all of us feel that people who have medical needs should be able to get it and don't have any kind of preconceived notion about the kind of person. It is still just having the control over the zoning and the number and where they're located.
Yeah.
All right, we have to leave it there. Thank you both for joining us. Before we go, we want to share with you what some of our viewers are saying about last night's topic, the housing market on the Suncoast. In the wake of the recession, the real estate market is making a major comeback. The prices of homes, condos, and townhouses all went up more than 7% in just the past year. Economists say as long as people keep moving to our state, the boom will continue. We asked what you think of your experience has been in the local housing market, and Nikki Velasquez says, it seems like everyone wants to buy new construction, made selling our house very challenging. April Akano writes, just sad because you know people who buy those new houses didn't grow up here. Sure, they look all nice, but they are out of my reach. And Kimberly Flaridge writes, and when will the next bubble going to bust? Well, what do you think about medical marijuana in our state? Join tonight's conversation by visiting our Facebook page at facebook.com/news@7. And FYI, you can watch past Roundtable discussions. They're on demand. They're available on Apple TV, Amazon Fire, and Roku. Thanks to both our guests for being here tonight. Dr. Barry Gordon is the chief physician at the Compassionate Cannabis Clinic in Venice, and Liz Albert is the vice mayor of the city of Sarasota.